And hello guys, welcome back to another episode of my channel. If you're new to my channel, you're welcome. If you're an old subscriber, thanks for coming back. And please, if you haven't subscribed to my channel, please click to subscribe to my channel. Turn on your notification bell to get notifications whenever I post my video. So in today's vlog, I'm going to be talking about the top 5 frequently asked questions on nursing job interviews and their answers. So the first question I'm going to be answering is, can I meet you? This is usually a common question. It looks simple, but sometimes people get confused on how to answer this question. So how do you answer this question? So when your interviewer asks you, can I meet you? What he or she expects from you is for you to tell him or her what you have in your CV, but in a nutshell. So you actually start by telling your interviewer your name, where you are from. You talk about your religion, your schools, your qualifications, and then your past job experiences. So after answering this, it has already answered the question, can I meet you? But if you have other things you want to talk about yourself, you can actually go ahead and talk about it depending on the time you are given. I can remember when I went for a nursing job interview, I was actually given 90 seconds, which is a minute and 30 seconds. So the second question we're going to be looking at today is, why should we hire you? So when you are asked this question, you have to convince your interviewer that you can fit in for the job, that you have the needed skills and experiences for the job, and also you need to convince him or her that you are the best candidate for the job. So if you have any way of describing your skills to your interviewer, this is a perfect time to tell your interviewer those skills you have. So the next question we're going to be looking at today is, why did you leave your last job? So when you are being asked this question, you don't have to be nervous or anxious. Just be free and relaxed. Be open to tell your interviewer the reason why you left your last job. If you actually left your last job because of salary issues, then you have to tell your interviewer that you left your last job because the salary you were being paid was poor, and then you needed to upgrade, you need a better salary. You can also tell your interviewer that you left your last job because you need a better or a best opportunity, and that is why you've applied for this job. So the fourth question we're going to be looking at today is, what is your strength? When you are asked this question, what your interviewer actually wants you to talk about is your skills. This is a perfect time for you to tell your interviewer those skills you have, because your skills are your strength. So what are these skills we're talking about? You can talk about interpersonal skills. Interpersonal skills actually means relating with other healthcare workers, like as a nurse, relating with the doctors, the physiotherapist, the lab scientist, the pharmacy. So interacting with them will help to ensure proper continuity of care. It also helps to ensure quick recovery of the patient. So another skill you can talk about is communication skills. When you are communicating with other healthcare workers, it helps to ensure continuity of care too. It also helps to ensure patients' quick recovery. So the last skill you can as well talk about is dedication. You have to convince your interviewer that you are always devoted and committed to your job. This will help convince your interviewer and helps your interviewer to employ you for the job. The last question I'm going to be answering today is, what is your weakness? This question is the most challenging, of course. It is the most challenging because if you're not careful enough, this question can lead to your elimination. So when you are answering this question, just be open, be real. Tell your interviewer your weakness, but remember to convince your interviewer that you've actually worked on this issue in the past. Convince him or her with the skills or how you've worked to improve this issue in the past. Also let him or her know that you've actually learned some skills that helped you combat this issue in the past. Be confident in yourself. I hope you found this video useful. If you found it useful, don't forget to give it a thumbs up, share, comment on my videos.